We've always known, whatever the projections from the different modelers, that when we got into April, with a doubling of the number of cases and a doubling of the number of deaths every 3 or 4 days, that this was going to take us into this really difficult time. I mean, we're now heading towards 1,000 deaths a day as we go towards the Easter weekend. This is really tough, and it's not going to get any easier as we go through the Easter weekend. Today, the new total of deaths is in at 854, so it's quite a significant increase on yesterday, but there seems to have been something of a weekend effect yesterday, that the reporting of the numbers seems to suffer over the weekend, and then they do a catch-up on the Monday. There was some speculation yesterday that it might be levelling off, but I don't think there's any grounds for thinking that at the moment. I think we just got to be very careful about all these different modelers with their different approaches. The Daily Mail has been reporting that there may be a significant underreporting, and that we may be looking at 80% higher than the data that we've actually got. And there may be some grounds for thinking that way in terms of these deaths that we get told each day just being the hospital deaths. And we've been hearing about individual care homes, for example, in Glasgow, and there's one in Liverpool and some other places where there've been quite a number of deaths in just an individual care home. And the care home situation is clearly a worry. And we do really need to have a proper comprehensive figure to know where we are. It's a bit like the testing story. If you don't know reliable data on the incidents, and you don't know the reliable data on the severest outcome, that's to say deaths, you really are somewhat in the dark. Prime Minister's now been in intensive care for getting on for a day. It's still not clear exactly his condition, although they're saying that he's not been ventilated, and it sounds as though he's not been sedated. So that bodes well, in as much as it's not as serious as it might be. But he's obviously not been doing very well, and it must be a matter of concern. And it just reminds us that here you have the national political leader who's gone down with the virus. I'm sure there'll be plenty of commentators remarking on the fact that he seemed to be a bit slow to take his own advice about mixing and shaking hands and so on. But I think now people are just rooting for him to make sure, hopefully, that he's going to be okay. But it seems as though it's put the government onto the back foot again. And it's really important that the political side of the House should be coherent with the science and public health side of the House, because we've got to continue to press forward in a positive way to minimize the damage that this might do otherwise. The impact of the political leader of the country going down with the virus and being hospitalized in intensive care really is a wake-up call. And it reminds me from my childhood, one of the things that happened around the polio vaccine in the 1950s. There had been a disaster with the early polio vaccine forms, that it should be an attenuated form of the virus. That's to say, it's been treated to change it, so it's not quite live. But it still has the same effect. And there'd been a disaster in Germany where a lot of children had been given polio virus that hadn't been killed, and where a lot of children developed polio, and that really put people off the vaccine, not surprisingly, when the new vaccine came along. And there was great resistance to people taking the vaccine. And then one of the Southampton football players developed polio. And within 24 hours, there were queues around the block in Southampton for people to get their kids vaccinated against polio. And I think, we may see something of the same effect here with some of these folk who think, they're lived a privileged life. They think, it won't happen to me, not in the category. I think it's been a bit misleading, this emphasis on only older people being vulnerable, because actually, in recent days, it's become clear that it's not confined to older people, although it tends to be older people and people vulnerable for other reasons. We've had quite small children have died from the coronavirus. And it's not going to leave alone people just because of their position or their wealth or their age. So it may be this will have an impact on the distancing measures sticking and holding, because we need that to happen for quite a while yet. It seems that also that President Trump has offered to send some supply of hydroxychloroquine for Boris Johnson, and I think this story about the experimental use of medicines to treat the coronavirus is changing by the day now. I had reports from quite early on from China back in February that the Chinese were beginning to use medicines that had previously been used for other things, for instance, for treating HIV and AIDS, or anti-malarial drugs and so on. And the position here and in other Western countries until recently has been that if you're using medicines that have been licensed for one disease condition and you want to use them for something else, then they've got to go through tests again for that condition to see if that's going to be okay. Now, that position seems to have been fraying around the edges, and there was word from Australia about the use of the hydrochloroquine the other day from parts of Canada, and there's a position that may be shaping up of saying, instead of having to wait for these double-blind kind of control studies on patients, that you may be moving to a position where some of them are used under careful supervision, making sure that everybody who gets them is logged on a central register or something like that. I think we may see some movement about that in the next days. I mean, I'd been drawing attention to the use of these in the Bahrain situation, where the combination of hydroxychloroquine and the antibiotic azithromycin, that's used for the complications of the chest infection side of it, but also the use of zinc elements is being part of a cocktail. I think we're going to hear more about that in the next few days. And it's interesting, this changing position on practices from elsewhere, because it also applies to the story on masks. And I've just seen that the World Health Organization is now changing its position, if my information is correct, to recommend the use of masks as well, as has happened in the United States over the last few days. So this may be yet another example of where we've taken a position and then had to backtrack on that later on in the light of changing consensus around the world. You know, this rather scary notion that surfaced from time to time during this whole emergency, that older people might be in some way dispensable, is appalling. It contravenes our whole approach to human rights, that each person is equal. And I really think it has to be resisted. It's not to be confused with the understandable assessment that when people are becoming old and frail, then there's a trade-off between whether they can benefit from treatments, particularly vigorous and invasive treatments, disruptive treatments, treatments that might take them from the comfort of their home environment into an intensive care unit, and where they're frail, and where the actual procedures may in some ways be more damaging than the actual condition. Those are things which people have to make judgments about for themselves. And you know, as you go into your 80s and your 90s, if you're lucky to survive that long, people need to think about those questions for themselves about where they want to be as they come to the end of life. It's something which I faced myself with my mother when she was in her final weeks, and you know, the decision about whether she should be in hospital or whether she should be at home, difficult decisions. But you know, she knew what she wanted for the best. I know what I want for the best for me. We each of us need to think about those things. I did some work in Cumbria when I was Director of Public Health there, where we had the use of a Californian woman called Mary Mathieson, who'd been working with a project in California called Conversations for Life. And this we did across the county of Cumbria for 2 years, running lots and lots of workshops with churches, with community organizations and so on, just encouraging people to think through what they want when they're coming towards the end of their life, and make sure their loved ones know, so they're not in that awful dilemma and feeling that they must keep doing things when actually it goes beyond sensible to keep doing things. You know, there's an expression they taught us at medical school, which comes back to me at this time, which is, "Thou shalt not kill, yet need not strive officiously to keep alive." And, you know, there's a sort of common sense dimension to this, which sometimes gets lost because people think they just got to keep going, when it may become a matter of managing a person's final days and weeks, managing out their life that they've lived, rather than just keeping going. So that has to be set against this sort of crude, primitive stuff that seems to surface at these times about, well, they're old anyway, they've had a good innings, you know. And I think we have to resist that at all costs. They say the only two certainties in life are birth and death. And, you know, we look across our own time. When we're young, we think we're going to live forever. I think often it's common experience that when you're getting towards the edge, towards the time when your parents passed away, that you tend to think, well, maybe it'll be my turn soon. You know, I have a cousin of mine who's a farmer, said to me when all that generation had gone, he said to me, you know, John, we're in the next pen. You know, those thoughts do cross people's minds. But my brother, who's no longer with us, and he died a few years ago, but he took the view, what you need to do is think about these things, make sure you've got your arrangements in place, like having a will, having a living will, or a you know, testimony that says how you want to be treated in those last days if you're no longer competent to make decisions. Do all that stuff and then get on with your life. Live your life to the full. But I think the problem, and you find in lots of families, is that people have been so frightened to confront it, they haven't done all that. And then when you get to these situations, it gets very tricky emotionally and practically for people. So, you know, my advice is really, once you reach the age of majority, certainly if you've got your own property and you don't want it to go to the Chancellor of the Exchequer when you pass away, you need to make sure you've got a will in place. And from the point of view of this kind of difficulties that might arise at end of life, having it explicit about a living will, enduring power of attorney is the legal document, which is quite a simple document to fill in. I've done mine. Then you can rest assured then and just get on with your life. I think that's the attitude to take. It's perhaps more of a Buddhist attitude than the one we're used to here in the Western world. It's very important that we don't allow this to get on top of us. I think The mental health sides of this emergency are important. We haven't spoken much about them. We need to. We've got to look out for the folk who are mentally vulnerable, make sure they feel supported. I know from talking to people, some people have stopped watching the news. Have they stopped, looking at this because it's really overwhelming to them? And I think we need to respect that. We need to support people, find diversions. Easter weekend, it's Easter egg time. There was all that fuss about whether Easter eggs were a priority. I say, yes, they are a priority. We all expect to have an Easter egg on Easter Sunday. And I think just make sure you've got yours sorted out, because we don't want to be left without if there's a rush on them. And the other things you can do at that time, with hiding Easter eggs around the house, hiding eggs around the house, playing games and stuff like that. We need to constantly look for the positive things that you can be doing. But yeah, we will come out the end of this, and we've just got to stick with it. It's difficult for people. I think it's difficult for younger people, perhaps, or people who haven't been through things before. When you get to a certain age, you've had experience of loss, of bereavement in your own family, and so to that extent, you become hopefully more resilient to the realities of life, the things that life brings. But we must be sensitive to those who haven't had those experiences yet. And, I sometimes reflect back about how wonderful life was before all these things happened to you and you had to cope with them. But at the same time, life is an amazing journey. And there's always something to find. My old landlord in Newcastle, when I was a medical student, he was a wonderful old man. He'd been in the Navy in the First World War. He had Parkinson's disease. He used to live on the ground floor of the house, which always had medical students in it. And he used to have an battered old typewriter, which he used to type letters off, raising money for the London Missionary Society for work in Africa. And he always used to say, John, he said, there's always some bugger worse than you. And I think that was always a reassuring thing to say. There's always some bugger worse off than you, So I hope that's lightens the mood, but it's important to remember there's a lot going for us and we're going to come through this. Programs like this are critical in reaching out to people without any prejudice or bias. Open media, alternative media. Join the future of journalism. Join Double Down News on Patreon.